Chronic pain really has very, very far reaching effects, many of them that we can actually measure. So, behavioral effects are what we're talking about here tonight. As veterinarians and as pet parents, we think about these physiologic pieces. So, where does it hurt? How long has it been hurting? What's the onset of that? What is the intensity? What is the quality? What is the pattern? That's a little bit harder in our veterinary species because they can't tell us exactly how much. We have to use those behavioral signs, those postural signs, those facial changes to really get at that intensity piece. But more and more, we're recognizing these effects on emotional state. So, on mood and on anxiety and on overall well being and quality of life. And that's why this is so important for us to think about and to treat, because it really has this emotional component. Cognitive effects. So, particularly on their ability to cope, there's more and more research, and we're doing some on actual cognitive effects, so on how they think and problem solve. But one of the things that we see is this decrease in the ability to adapt and to cope with change, which is really important when we think about how we manage our patients. And we'll talk about that in a second. Those behavioral ones that we focus on a lot are changes in activity, medications that they may need or take, the pain behaviors, which is what we'll talk a lot about, and then changes in their sleep, which again can affect all of these other pieces. So we know if we don't get enough sleep, that can affect our emotional state, can also increase the sensation of pain. So this is a busy slide, but just showing this cycle of pain and stress and why it's important for us to be thinking about this in the management of our patients. We'll talk about this again when we talk about musculoskeletal pain and noise phobia, for example. So, when we see fear and anxiety, that can increase the perception of pain, the sensation of pain. It can lead to more stress, and this becomes a cyclical problem where I'll point out, especially the tight and tense muscles, the weak muscles, the inability to escape and to get away. So, all of those will then increase fear and anxiety. One of the reasons that the noise phobia has been thought to be related to musculoskeletal pain is that when something is frightening, when you hear a frightening noise and you tense up all your muscles, if you have chronic pain, that then builds an even stronger negative association with that sound, right? So that can contribute to these more extreme cases of noise phobia in those dogs. Other characteristics of chronic pain that are important when we think about the behavior are the ways that they can lead to downstream changes. So this over here on the right is a normal and a affected pain curve. So when we look at in blue, our normal pain response, we have stimulus intensity against the pain intensity. So as the stimulus intensity goes up in blue, we expect the pain intensity to increase. That's what's normal. When we have chronic pain, we see a shift of that curve to the left. So now we see in red stimuli that were not painful before now are considered painful. That's our allodynia, right? So now that if we have a injury on our finger, that area around it, just light touch may hurt, right? And when we get to stimuli that would be painful, now they're rated as even more painful. So our hyperalgesia. So those chronic downstream effects are not defined by time. So again, that spectrum from acute to chronic, from adaptive to maladaptive, is not strictly driven just by time. It's driven by these changes in the somatosensory system. But what it leads to are behavioral changes that are reflective of more defensive behavior, right? So protecting that area, learned avoidance. So not doing things that are going to hurt. So that's changes in our social interactions, for example, or behaviors. We're not going to jump up onto that couch anymore because we know that that hurts. So we see these changes in behavior that are reflective of these shifts in the somatosensory system. And we see this central and peripheral sensitization. So an overall increase, winding up of the entire system. So I'll just wrap up with the interplay between these pain behaviors and behavior disorders. means that we really have to think about both the physical and the mental health for almost all of the presentations that we see. So I think there's really been an increased push to think about whether pain could contribute to the behavior condition that you're seeing. And when we remember how much stress can exacerbate pain, what are the pieces that we can impact with environmental management or with stress management in the home that can also contribute to decreasing pain and improving physical health. So, really taking this more holistic view.